And to begin, we're beginning with a session created by our underwriter, and for that, please welcome Bob Marino. He's Chairman and CEO of Horizon Blue Cross Blue Shield of New Jersey. Kevin Conlin is Horizon's Executive Vice President of Healthcare Management, and they're here with Maggie Moran, Managing Partner of the Public Affairs firm Kivvit, and she will lead the conversation.
Thank you, Mark.
Over to you, Maggie.
Good morning, everybody. Now, before we get started, I think, Bob, I have a quick question for you. We want a lot of transparency and candor around this question. You're a North Jersey guy, born in Newark. Yankees or Mets?
Yankees.
So that's good. So you weren't up late last night to watch that moment.
Didn't even bother.
In all seriousness, thank you to The Atlantic for putting together such a tremendous forum here today with such important stakeholders on this topic. Bob and Kevin, thank you for being here. I think we all know that it's pretty remarkable when you look at the spend in this country as it relates to health care. A sixth of the U.S. economy devoted to health care spending, $2.7 trillion. And in recent years, there's been a tremendous focus on whether the spend matches the value. Bob, this has been your life's work, and this national conversation is happening nationally, globally, and in New Jersey. Talk to us a bit about transforming and reinventing healthcare from Horizon New Jersey's perspective and your perspective.
Sure. Well, thank you, Maggie. Well, I think we've done a lot of thinking around this, and we've concluded that the current fee-for-service system is simply not sustainable. It's not sustainable here in New Jersey, and we don't believe it's sustainable across the United States. I think, as we all know, the fee-for-service system simply rewards the volume of services that are performed and not necessarily improves the value of services performed. So we're very committed to transforming the delivery and financing system here in New Jersey to move from a fee-for-service volume-based system to a fee-for-value system. And we're defining value as better outcomes, improved quality, better patient engagement in the delivery of care, and importantly, lowering the total cost of care.
And what's the sentiment around this transformation? You say the fee-for-service is a very expensive model without the best outcomes. In New Jersey, what does that expensive care mean? We're a high-cost state. What are the impacts of the fee-for-service model?
Yeah, indeed. For example, I think there was a recent report by the National Association of Insurance Commissioners that reported that New Jersey ranks second in terms of highest health care cost in the United States. And also importantly, the increase in health care cost in New Jersey is rising 25% faster than the national average. And clearly, we have heard from our customers across all segments of our business that the status quo is simply not sustainable.
So on the heels of that, Kevin, if I could turn to you, what specifically has Horizon done in New Jersey to evolve this model and create better outcomes?
Yeah, our efforts along these lines started several years ago, actually. We reached out to like-minded physicians and then behind that hospital organizations who shared some of the frustration of the results that Bob just shared, which is the fee-for-service model is not getting us where we need to be. So through a lot of dialogue and a lot of collaboration, we identified first physicians who were willing to take a different approach to the way that care was delivered, and which matches up with our own vision, which is if we can find a way to manage patients differently and do it in a way that we can get them healthy and keep them healthy, not only will the quality of their life be better, but the total cost of care over time is actually going to be better. Thankfully, there's been a great deal of receptivity to this idea. We've also made some changes with regard to the way that we pay physicians and hospitals to achieve these outcomes. We're at a point now where we've got 6,000 physicians who are participating in patient-centered medical homes across New Jersey. We have a number of hospitals and physician groups who are participating in accountable care organizations, and we are now offering episodes of care bundling around 16 clinical conditions, and we're in the process of improving on that. All in, we have in excess of 750,000 of our members who are benefiting from the more efficient and more coordinated care that these new approaches provide.
So that's to say, as of this moment in time, you have 750,000 members that are involved in patient-centered care today. Does that create metrics and measurable outcomes that we can look at to see if this model is actually creating better outcomes, better care at lower cost?
Well, it presents the opportunity, and we've taken the opportunity. In fact, from the very beginning, we knew that we had to compare the effectiveness of these new approaches against what I would call the traditional approach to that. And our view all along was that if we could improve the quality, we could actually get the cost down. So on the quality front, in 2013, we compared our performance with patient-centered medical home against more of the traditionally managed members. And in the new approach, more the value-based approach, we've actually seen a 14% higher rate in diabetes management, a 12% improvement in cholesterol management, an 8% higher rate in breast cancer screenings, and a 6% higher rate in colorectal screenings. So this was, again, value-based approach against traditional. In 2014, not only did we continue to see an improvement in the quality results, for instance, a further improvement in improved diabetes control of another 6%, and a 7% improvement in the breast cancer screenings. But our theory all along was that if we could succeed at getting these measures improved, we would see an improvement in the utilization. And we saw that in 2014. ER visits actually reduced by 5%.
Wow.
The level of inpatient admission reduced by 8%, and that resulted in the total cost of care as managed in this new way being 9% lower than the traditional. So obviously we're very encouraged by that.
Yeah, this is exciting. So in essence, the proof of concept for this 750,000 members has really been proven. So Bob, back to you. What does Horizon do with that now that you know that the model actually works?
Yeah, well, indeed, as Kevin indicated, we're very encouraged and pleased by the results that we have with the model. And I think the first thing that we'll continue to do is continue to promote very actively value-based arrangements with all physicians and providers in the state. Secondarily, last month, as many of you know, we announced what we feel is a very innovative, groundbreaking collaboration with 7 leading health delivery systems in the state. And this collaboration that we've created through the Omnia Health Alliance, we are really committed to delivering on value-based care and transforming the system from fee-for-service to value-based. We're excited about that alliance. We are intellectually aligned with our partners in terms of the need that we can no longer defend the status quo, and we need to change the system. So we will continue to promote actively value-based reimbursement.
And so is the Omnia Health Alliance a product that specifically gets at formalizing this model into a product format, Kevin? Is this where we're headed in terms of a new offering for your consumers?
Well, it is. But before we get to the product, Maggie, the alliance itself, as Bob just mentioned, is a series of partnerships with these leading organizations who share our commitment to changing the way that care is delivered. And one of the measures that we're going to use, one of the really levers that we're going to use to make that change is by incenting improvement in the quality and improvement in the member's experience, and also a reduction in the total cost of care.
Can you walk through what that means a little more specifically?
Sure. Currently, really all healthcare providers are reimbursed on the basis of the units of care that they provide. The more units of care provided, the more they're able to bill, and the more that they're able to be paid. Often, there have been a lot of studies that indicate that additional volume of care doesn't necessarily improve the curative process, or doesn't improve the accuracy of the diagnostic approach. So what we are essentially incenting is improvements along those 3 measurements: cost, quality, and the member's experience as they're accessing the healthcare system. And as our partners improve on those, their payment level will actually improve also. So in effect, we're standing the payment mechanism, and we think the incentives, on their head. And we're confident, based on the approach that we've done so far in some of our other patient-centered programs, that the results are going to mirror what we've seen up to this point in time.
And so one of the basic fundamentals here is the idea here that you're operating off of a tiered network, right, Bob?
That's
correct. So there are a number of people in this room who may know the difference between tiered and narrow networks, but not necessarily everybody. And I think there's some confusion around this in terms of the nomenclature. Can you walk us through the difference between a tiered network and a narrow network, and what Omnia is?
Yeah, sure. I'd be happy to do that. We chose at Horizon to use what we're calling a tiered network construct, which means that all of our members who select an Omnia product will continue to have access to our broad managed care network, the largest managed care network in the state of New Jersey. However, if they choose to use a Tier 1 provider that we've designated within that broad network, they will see two things. The first thing they're going to see is reduced premium for the Omnia product. And the second thing they'll see is lower out-of-pocket cost if they elect and choose a Tier 1 provider. We did not choose a narrow network approach, which many other organizations have chosen throughout the United States. A narrow network approach really limits the number of providers in the network, and the members are limited to use of those limited providers, if you will. So we chose a tiered approach. We think it is more, our customers seem to like the concept. As a matter of fact, we did some recent polling last month, and by a margin of 3-1, customers really do like a tiered network construct because it provides them with an alternative to the traditional products. They'll see the benefit of lower premium, and if they opt again to use a Tier 1 provider, they're going to see lower out-of-pocket cost.
And again, this is a choice that folks have. They can continue within the traditional network that exists at Horizon
Totally,
today.
totally. The Omnia products are a choice. It's an option that we're providing to all of our members. We continue to offer and will continue to offer our broad set of products. The Omnia product is in response to what we've very clearly and loudly heard from all of our customers, which is that they need a lower cost, better, more effective alternative. And we believe the Omnia products will provide that.
I think one of the things that we all struggle with, we all love and adore this state, but it's a high-cost state to live in. You've talked a lot about the consumer surveys and consumer demands you've heard. What about small businesses and businesses in general? How are they reacting to this product offering?
Very positively. As a matter of fact, we're projecting in year one somewhere around 250,000 customers will choose an Omnia product. But importantly, 72% of that projected enrollment are individual consumers and small businesses that are really being crushed by the cost of health care in the state of New Jersey. And importantly, we also project that of that 250,000, about 147,000 are individual customers. 40,000 of them are currently uninsured.
Say that again?
40,000 of the 147,000 individual customers that we expect will purchase an Omnia product are currently uninsured. So clearly, it's the individual, small businesses, it's families, it's large businesses that are simply being crushed by healthcare costs in the state of New Jersey.
It's interesting. So following up on that, I think as we look at this evolution, and change is always hard, no matter what industry or sector it's in. You know, there are some stakeholders, I think, who are demanding of you to create options for them. And there are other stakeholders that are saying, you know, let's slow down, let's study it more. Do you think Horizon is at the right pace? I mean, how do you respond to the stakeholders who say, let's do more study?
I think we're at a point, and certainly in the delivery of health care, when we look at the data out there, and as I mentioned earlier, we're the second most expensive state in the United States. When we constantly listen to our customers and we look at the market research, there's clearly a demand for a change. There's clearly a demand for a change in the status quo. We feel strongly we are very committed to moving the system from a fee-for-service volume-based system to a value-based system. We believe the time is right. We're committed to this strategy. We think it's the right choice for New Jersey.
And Kevin, would you say that the partners you're collaborating with in creating these tiers and this lower cost model, more patient-centered model, are they as committed to this new program? And there are risks inherent across the board, right? As collaborators, are they as excited about it, if you will, as the Horizon leadership team is?
My clear sense is that they share our excitement. They share the philosophical alignment that a significant change needs to take place. And I sense that through all the conversations I've had with these new partners that really what they're saying to us is they know that this is the future. They needed a payer with some strength and some commitment to step forward and match up with them in order to change the way the care is delivered. And I think therein lies really the kernel of their excitement and enthusiasm about working with us.
And how extensive would you say, Bob? I mean, a lot of this change is important for the consumers to really understand and wrap their arms around what options they have available to them. Forums like this obviously are quite important. I assume that you are almost on the road constantly these days trying to create a level of public education about some of these fairly complicated issues for an average consumer.
Yeah, I think that's a fair statement, Maggie. Clearly, you know, healthcare is a very complex business, and health insurance is equally complex. We speak a very unique language, and sometimes we forget that we speak that unique language. So we've invested heavily in educational efforts around the Omnia Alliance, around the Omnia product. We're very committed to assuring that people understand when they purchase an Omnia product what a tiered network is, how their benefits will operate. We're creating dedicated service units at Horizon and dedicated customer service representatives to service the Omnia product. I am very comfortable with the amount of effort and investment we're making in education with respect to the transition and in particular the Omnia product.
So this is so exciting. I feel like we should have had like a Steve Jobs setup this morning where Bob Marino came out in a black turtleneck and some jeans and we had sort of a big stage, because what you're really talking about here is an innovation that for once sort of aligns well with all the positive priorities you would want, both in terms of service for patients as well as cost as it relates to both businesses and consumers.
Yeah, I agree with that. Clearly, this is what we're doing is new, it's innovative, it's bold, it's challenging the status quo. We expect that there will be people that not necessarily are aligned with our thinking, but we're very committed to the strategy. We're very committed to the value-based reimbursement. We're very excited about our Omnia partners, and we just think this is the right thing to do for the state of New Jersey and our citizens.
I think that's a tremendous place to close. If you all would join me in thanking Bob and Kevin for our conversation this morning.